Welcome to this explainer. Look, today we're tackling something that is quite literally a matter of life and death. We're diving straight into the 2026 AHA-aligned protocols for using an AED, an automated external defibrillator, on infants and children. Our goal right now is to clear up the confusion and totally eliminate any hesitation you might have about stepping in to save a kid's life.
Since we're dealing with high-stakes emergency protocols here, let's just lay out a super clear roadmap. We're going to cover 1. The number one rule. 2. By size, then by age. 3. Proper pad placement. 4. Pediatric doses. And finally, 5. Confidence to save. Let's get right into it.
Okay, picture this. You're at a youth soccer game, maybe a school playground, and the absolute unthinkable happens. A child collapses in cardiac arrest. Every single second is ticking away. This brings us to the one massive question that completely paralyzes parents, coaches, and bystanders. Can you actually use an adult AED on a child? The answer is a definitive, undeniable yes. You can. And honestly, you absolutely must. This is the bedrock of everything we're exploring today. When a kid's heart stops, an AED is the only effective treatment for the rhythms that device detects. All right, Section 1, the number one rule. Don't wait for perfect. If you only take away one single thing from this entire explainer, please let it be this exact AHA-aligned golden rule. Never withhold defibrillation from a child because the perfect equipment isn't on hand. I really want to let that sink in for a second. It is incredibly common for people to just freeze up, waiting for paramedics, or frantically tearing through bags looking for specialized pediatric pads. But delaying a life-saving shock just because you don't have the ideal pediatric gear, that's infinitely more dangerous than using what you have right in front of you. A shock is always, always better than no shock.
And you know, this principle applies even to the absolute littlest ones, including infants under 1 year old. Now sure, the ideal scenario is a manual defibrillator run by trained medical pros. If you don't have that, your next best bet is an AED with a pediatric dose attenuator. But what about a true emergency where neither of those is an option? You grab that standard adult AED and you use it. You don't wait. You don't overthink it. The core principle stays exactly the same across every age group. Do not delay waiting for better equipment.
Moving right along to Section 2, by size, then by age. Choosing the right pads.
So how do we make that split-second call? Here is your mental anchor. If the child is under 8 years old or under 55 pounds, which is about 25 kilos, you need to use pediatric pads or a pediatric setting if your device has one. But if they are 8 years or older or 55 pounds and up, standard adult pads and standard energy are your go-to protocol. Just burn this simple metric into your brain: 8 years or 55 pounds. Okay, Section 3, proper pad placement. Anterior, posterior.
Because kids naturally have much smaller chests, slapping two giant adult pads side by side on the front just isn't going to work. Instead, you're going to use what's called an anterior-posterior, or just a front and back placement. Step 1. Slap one pad directly on the center of the child's bare chest, right between the midline and the left nipple. Step 2. Put the second pad smack in the center of their back, squarely between the shoulder blades. Just make sure the skin is totally bare and dry first. And here is the absolute non-negotiable physical rule of the whole shebang. Those pads can never, ever touch each other. If pads overlap on a tiny torso, they can actually short-circuit the electrical shock. It literally just bounces across the skin and does nothing for the heart. That is exactly why we use the front and back method for small children. It practically guarantees the electrical current travels directly through the heart muscle.
Which brings us to Section 4, pediatric doses. The science of energy.
Let's talk numbers really quick to understand why this matters. A standard adult AED delivers a massive jolt of electricity. We're talking anywhere from 150 to 200 joules. But a pediatric dose attenuator, it substantially steps that energy way down to roughly 50 joules. A child's smaller body just requires a much lower attenuated dose to safely and effectively reboot the heart's normal rhythm.
You might be wondering, well, how does the machine actually know to lower the dose? Manufacturers manage this 50 joule reduction in a few really clever ways. A lot of the time, you'll see pediatric pads that have the attenuator built literally right into the wires. Other times, the device might have a specific pediatric key or a switch you flip, or it might use a combined cartridge system. And what's brilliant is that pediatric pads almost always use distinct visual cues, like being bright pink or blue or having literal cartoon kids on them, so you absolutely will not confuse them with adult pads when your adrenaline is pumping.
Because this pediatric capability is such an absolute game changer, it totally dictates where this equipment needs to live. Honestly, any environment where kids gather on a daily basis has to ensure they stock pediatric pads right alongside their standard AED. We're talking schools, daycares, youth sports facilities, pediatric clinics, youth programs, and even family homes. Ensuring the right equipment is hanging on the wall before an emergency even happens, that's literally half the battle won right there.
Finally, Section 5, Confidence to Save. Ready to act.
Let's just hit the nail on the head regarding the deepest, most subconscious fear out there. It's the thought that holds so many well-meaning people back. Can firing an AED actually hurt the child? It's a totally natural worry. You're holding this powerful, somewhat intimidating medical device and looking at a vulnerable kid. But the pure scientific fact here is no. The device will only ever advise a shock if its internal computer detects a highly specific, treatable rhythm. You literally cannot accidentally shock a healthy heart. Modern AEDs are insanely smart. Because of this, the risk of not acting, of leaving a kid in cardiac arrest without doing anything, is infinitely greater than the risk of delivering a shock. The AED does all the complex thinking for you. You just have to provide the hands to make it happen.
Which brings us to our final takeaway. Armed with the knowledge that an AED is safe, it's smart, and it is fully ready to guide you step by step, the only variable left in this whole equation is you. So think about it. If a child's life was on the line right this exact second, are you ready to step forward and act without hesitation? Keep this knowledge in your back pocket, share it with someone who needs it, and stay prepared.